Hi, my name is DonnaJeanLogsdon. I'm a student at Monroe Community College, English 101 with Professor Jacob Bodway. This is my final presentation, Treating Bipolar Disorder Physiologically. Bipolar disorder is a mental health diagnosis that is used when a person shows signs of both mania and depression over the course of treatment. It's a physiological chemical imbalance that's treated by medication, and often psychotherapy is included in the treatment plan. In general, bipolar disorder can be treated by a knowledgeable general practitioner and should no longer be classified solely as a behavioral mental health diagnosis. It's treated as a chemical imbalance and stabilized with the same medications that are used for seizure disorders such as epilepsy. If it begins to be treated as a physiological disorder, then other treatments, such as dietary changes and sleep modification, can be used to stabilize or reduce the occurrence of and effectively calm brain function imbalance. Bipolar disorder is a lifelong condition that develops in adolescence, sometimes childhood, and affects the brain chemistry. Studies have shown that bipolar disorder is genetic. Children of a parent with bipolar disorder have an increased likelihood of developing major depression, ADHD, or bipolar themselves. In studies of twins, it's been shown that if one twin has bipolar, the other twin has a higher chance of developing bipolar than other siblings. It's believed that bipolar symptoms are caused by noradrenaline, dopamine, and serotonin levels. When these brain chemistry levels increase or decrease past certain levels, they cause the brain to react in ways that are out of the norm. Abnormal brain function involving serotonin is believed to cause depression. Low serotonin levels lower mood swings, while increased dopamine is commonly linked with a pleasure system of the brain and can lead to mania. A main course of treatment for bipolar disorder is psychotherapy, where the patient discusses personal issues with a trained therapist and such as a psychologist. But successful treatment depends on a combination of factors. While talking out one's problems is generally a good idea, if the patient is unable to physically make the needed changes, it does no good to talk about the issues. In order to get the most out of treatment, it's important to educate yourself about the illness, communicate with your doctors, make healthy lifestyle choices, and stick to your treatment plan, according to Smith. Since there are no lab tests to determine bipolar disorder, doctors need to routinely conduct medical tests to rule out specific ailments. It often takes numerous office visits to correctly diagnose bipolar. There are many conditions that present the same symptoms, such as thyroid disorder, which causes mood swings that can be confused with bipolar, as can B12 deficiency, adrenal disorders such as Addison's disease, and neurological disorders such as epilepsy and multiple sclerosis. Doctors need to complete a full family history and screen for these and other disorders before diagnosing bipolar. Testing and care should be standardized in all areas so that everyone is getting the same information from their medical provider, no matter which region or state they live in. In order to treat bipolar effectively, patients should have knowledge of the disorder and how it physically affects their brains and their physiological functions. When a patient develops a disease such as a brain tumor, doctors give that patient all sorts of information and possible medical treatments. Brain tumors also cause mood swings, but they are not considered mental disorders. Neither should bipolar. With bipolar disorder, when it has the same basis of medical treatment, with a psychiatrist acting as a specialist instead of an oncologist. Doctors should provide all medical information available and explain about brain chemistry and the effects of different chemicals rates on the patient's moods. Patients should not be left to do their own research and possibly gain incorrect information from social media groups that consist of other patients who similarly should have been given more information. If bipolar were treated as a brain disease that it is, patients would have a team of caregivers, from their psychiatrist to a dietitian and nutritionist. Information would be freely shared with patients so they understand that bipolar is a physical reaction to a chemical imbalance in the brain, and they can take an active part in their own treatment. There are more options for treating bipolar than simply taking a daily medication and speaking with a therapist. Patients should know that it's not their mood that's the issue, it's a chemical reaction that should be treated. Leaving bipolar unattended because it's being looked at as mood swings is very dangerous to the patient and to the people around them. Hereditary brain disorders should be classified as such so that people know the proper treatments available and precautions to take so that it can possibly be eradicated. Thank you.